Thank you everybody for coming. This is Awake and Thriving podcast. We have with us our guest. She is Nicole Matthiesen. She is a wellness and Ayurvedic health counselor. Thank you, Nicole, for coming.
Thank you so much for having me.
Yes. We were talking a little bit beforehand about all sorts of stuff. So can you tell me a little bit about what led you down the Ayurvedic path? I read a little on your website, but it looks like you had a lot of obstacles or health things that you were going through before you got
here. Yeah. So I actually used to work in litigation and had my own consulting firm in litigation, and it was great work. I loved doing it, but I was not taking very good care of myself. I was, pretty much working attorneys' hours and often longer than the attorneys because I was supporting them. I wasn't eating very well. I was eating whatever was around. I certainly wasn't sleeping much, and I wasn't moving. I was sitting in front of my computer the whole time. And, you do that long enough, you're going to get sick. And I did. And after numerous tests and doctors telling me they couldn't see anything wrong with me, a doctor finally told me that I had IBS, or irritable bowel syndrome. And, it was sort of strange because I kept looking for this answer, like how am I being diagnosed, or, what's wrong with me? And once I finally got a diagnosis, it really wasn't that helpful because he followed that with, well, there's really no cure and we don't really know how to treat it. He offered some diets. He said you could try medication, although he wasn't very hopeful about the medication working. And I wasn't really into taking medication for it. I felt like, I'm too young. There's got to be something else I can do. I'm not going to live with this for the rest of my life, because if you're not familiar with IBS, it can be really debilitating. Like, I had to cancel flights at one time. I had to miss out on, social functions because I would be in so much pain. And when I would have an IBS episode, it would take me a good week to get back to normal. Okay. Yeah. So I decided I got to look around. I got to find something else, see if there's something else that can help me. And I found Ayurveda. And so there was a low-cost clinic near my house, and I went to one of the counselors there, started taking some of their advice and was noticing some improvements. And so just kept doing more and more, from their recommendations, and was feeling better. And so I decided, okay, I'm all in. So I found an Ayurvedic practitioner and worked with her for a couple of years. And it's now been over 3 years since I've had an IBS episode.
Oh, that's wonderful.
Yeah, it's wonderful. But what was even more amazing to me is that while I went to Ayurveda to get healing for these digestive issues, I ended up getting so much more, because I've had seasonal allergies all of my life, but I don't have them anymore. I had a rash that doctors, it got called all sorts of different things. I even had one doctor tell me that I had this rash because I was getting old and my glands weren't working anymore, but I no longer have that rash.
What kind of rash was that? Who told you that?
A doctor, a dermatologist. Yeah. Yeah. I don't know what it was. I think I got different names for it, but some sort of a dermatitis. Some people, another doctor said it was eczema. So who knows what it was, but the good thing is it's gone now.
Yes.
And probably the biggest thing is that, since I was a teenager, I dealt with hormonal imbalances and depression, and I no longer experience that anymore.
Oh, okay.
So I had some pretty big life changes going through this process of healing with Ayurveda. And I got to the point where I thought, I can't work in litigation anymore. This has been so profoundly transforming that I want to share this with other people.
Yeah.
So I decided to learn more about Ayurveda, get some certification, and also become a wellness coach.
Okay, and so you got certification for and so this is, we were discussing earlier about there's Ayurvedic counselors, there's Ayurvedic
practitioners,
and then there's Ayurvedic MD.
So it's an Ayurvedic doctor. Yeah, I think
Okay.
it's BAMS is the certification, but they go to school for a really long time, like pretty much the equivalent of med school.
Oh,
An
okay.
Ayurvedic, yeah, an Ayurvedic counselor, which I am, is at least 600 hours of training in Ayurveda. And so with that, I work with someone either in a group or one-on-one, and we work on diet and lifestyle to help bring healing.
Mm,
And somebody who's a practitioner, they've just had, I think it's at least 1,000 hours of education. And so they have more education around herbs, whereas my education around herbs is pretty minimal. So if somebody needed some really deep healing, I'd probably send them to a colleague of mine who's a practitioner.
okay. All right. And so do you think when it comes to our diet, do you think that plays a big role? Or is it a combination of, because I, like you, have worked in a high stress medical
Yeah.
field for years, and it did to me similar to what you did to you, but it was my skin started reacting, and I was having
Mm,
insomnia, I was having anxiety, just trying to go to work. It was difficult just because we were expected to perform at such a high level every single day, and there was so much pressure on us every single day, and the shifts are long, and it was a tough thing to have to do day in day out, even though it's like 3 days a week, 2 days a week. It takes a few days to decompress from that.
totally. Yeah, absolutely. So yeah, food is a big factor, but I would say just as important and maybe even more important is lifestyle. Because you can be eating all the right foods, but if you're still living that super high stress life
Mhm.
and living in Ayurveda, we say out of rhythm,
Mm,
then that food isn't going to be properly digested. You're not going to be getting all the nutrients that you need from it.
yes.
So really living in rhythm and having what we call in Ayurveda a dinacharya, which is a daily routine that revolves around the dosha clock.
Okay.
That's really what brings more health.
Okay. And I've seen just, and I'm pretty sure law is very similar to healthcare, that performing under high stress and pressure is just expected. Like you don't go into those fields without knowing that you're going to get your butt beat more than
Yeah,
more than
yeah,
likely. And if
yeah.
you try to step away from that or even pull away, you don't fit in anymore, basically.
Yeah, well, it's interesting. There are some attorneys who have been able to step away, and that,
Mm,
I think what they've been able to do is create some balance through having a very specific routine
mm,
that's big on exercise and, not over exercising, but making sure that there is exercise and that there's movement throughout the day. And also just making sure they're sleeping, because that's the big thing. So much is happening in our bodies when we sleep that
yes.
if we're not getting proper sleep and if we're not sleeping at the proper times,
Yeah.
that's all out the window.
What do you, when there's so many questions that want to come out all at once, I'm like, wait, let me stop. So if somebody's having trouble sleeping, and it's been for like a few years, but there's not really any kind of personal things going on, do you start looking more at the diet and the routines? Like what is like when you come to you as like a new patient, like a new client? Here I am, and I'm having trouble
Yeah.
sleeping. What would you be doing? Like, what would you
Yeah.
be asking?
Yeah, so Ayurveda is holistic. We look at every aspect of your life, from what you're eating to, your bedtime routine, what you're doing during the day, what kind of stress you're dealing with,
Mhm.
what your relationships are like. I mean, we look at the whole picture.
Okay.
And so if someone were to come to me for a one-on-one consultation, they would be filling out a very extensive questionnaire.
Okay.
And then we spend about an hour, hour and a half going through that questionnaire, just making sure that I understand their answers. And it's hard to write everything down. So it's just good to have a conversation with someone and really sort of understand where they're coming from and what their life is like.
Definitely.
And so based on that, I can see where things are, whether it's activities, whether it's lifestyle routine, whether it's diet, I can see where they're being taken out of balance. And
Mm,
so then I would make some recommendations to help bring them back into balance.
okay. Okay. That sounds good. Just, I think a lot of people, especially in corporate America, may have some sleeping problems.
Yeah, it's a huge issue.
Yeah.
Yeah.
And it's not really talked about. Like people say stress, like that should be a normal part of work, like being that stressed. And I don't think it should be. Like there's like you're supposed to be competent and get your job done or your career, but having to function like that is not healthy, especially to be in the healthcare field and to be
Yeah.
expected to be so unhealthy. I'm like, this just doesn't seem right.
Yeah, it's really interesting. I have a friend who's he works with Western doctors, and he helps them bring wellness into their lives, because
Okay.
Western medicine, like those doctors, they're not really trained
Yeah.
to have wellness. You know, they're working crazy hours, and it's yeah.
Especially like the new residents, like they're worked like a workhorse. They work for hours, like
Yeah.
hours and hours a week. Poor thing.
Yeah.
If they see you in the ER, most of them like haven't slept, especially if they're the residents and they're seeing the patients for their attending who's at home trying to get some sleep. So yeah, getting
Yeah.
some wellness in, like I'm not sure how they can fit it in, but good for him for trying.
Yeah, yeah, yeah. I think he's working more with doctors who are already established as opposed to the residents.
Okay.
But yeah. I mean, that's the hard part, right? They're groomed to work like that.
Yes, they're
Yeah,
expect that's like a rite of passage. They're
right.
supposed to be under that kind of stress and not get any sleep for days because
Yeah,
that's bound.
that's also very typical in the legal industry too. Lawyers, especially the associates. You know, when I was working there, I would work 12 to 24-hour days for days on end sometimes when if we were in trial. Yeah,
My gosh. Yeah, that's
yeah,
pretty similar to the healthcare. They're like, oh, you're
yeah.
gonna pull a double 12-hour shifts, you're gonna work 24 hours. Yay, but you're getting more pay. I'm like, I don't know if pay is really factoring in for me right now because I'm
Right.
really exhausted. I've worked all day long. But um, if you don't take one for the team, it's like you're not being a team player. There's just whole politics involved in it as well.
Yeah, yeah. It's the culture of the industry is really
High
sort of,
stress, pressure.
yeah, yeah.
Hmm. Okay, so let's get back to doshas. And doshas, there's three doshas, right?
Yeah, there's three doshas. So doshas are they are these bioenergies. And so let me back up a little
Okay.
bit. So Ayurveda it's based in nature. And so it looks at us as being part of nature, right? So a lot of times we think that nature is out here, but really we're it, right?
Yeah.
We are part of the ecosystem.
Mhm.
And so the doshas are these bioenergies that pervade all of nature. And so if you've heard of Ayurveda, you typically, that's the one thing you've heard about. There's these mind body types called the doshas,
Yes.
but they're in everything. They actually govern the different times of the day and different ages of our life.
Oh,
Um, yeah, yeah. So it's really interesting. And all of the doshas are made up of the five elements.
okay.
And so when we understand the qualities of the elements and the qualities of the doshas, that's how we understand how to bring more balance into our life.
Okay.
And so I'll give you an example. There's three doshas. They are kapha, pitta, and vata.
Okay.
And we all have all three of the doshas in us. We have to. They perform very specific functions in our body. But we have them in varying proportions.
Hmm.
So I have a lot of vata, a lot of pitta, but not very much kapha.
Okay.
And so that's my unique Ayurvedic constitution.
Hmm.
Someone else may have a lot of kapha, a lot of vata, but maybe not much pitta.
Okay.
So if I were to have a headache and this other person was to have a headache, Ayurveda would approach it very differently, because what's causing my headache may be different than what's causing this other person's headache. And because they have a different constitution, we would have to look at everything that's going on to understand what's the best way to bring them back into balance.
Okay.
And so my constitution, we're all born with our unique constitution,
Hmm.
and that is our state of balance. And so let's say that vata part of me goes way out of whack. I have a lot more vata suddenly and less pitta.
Yeah.
That means I'm out of balance, and I'm probably going to be experiencing some sort of symptom. And
Okay.
so the way to treat that is to bring vata back into balance, so that I'm back in my natural state of balance. Does
Okay.
that make sense?
Yeah, it does. So it's kind of just like getting you back. You're getting realigned.
Yeah,
Right?
exactly.
Okay. You're getting
Yeah.
realigned. And so how long does that usually take? Like how many sessions? I know whenever I ask this question, it's never like 3 or 2. It's always, it
Right.
depends on the patient.
Yeah,
Go
it
ahead.
depends. It depends on the patient. It depends on how out of balance someone is. It depends on how long they've been out of balance.
Mm,
So for me, it took quite some time because I was really out of balance when I started working with Ayurveda. So I think my first introduction was around 2014, and it wasn't until 2017 that I stopped having the episodes completely.
okay.
And so it takes 3 years. That also depends a lot on the person too, right? Like if I was doing everything that my practitioner or counselors told me to do immediately, it probably would have taken a lot less time. But we're humans, right? We have habits, and it's hard to change those habits. So for instance, I was used to eating certain things, and it was really hard to give those up, but they were taking me out of balance. And so it was a process of eliminating one thing, and then maybe a month or two later eliminating something else, and bringing other things into that maybe I wasn't used to eating.
Mm,
And also just my sleep practices. Like I was used to staying up until 12 or 1 o'clock in the morning, and I had to change that. I needed to go to bed by like 9:30 or 10 to get my body aligned into the natural rhythms.
do you think that some people naturally go to bed late? Because you know how there's some people that say, "Oh, I go to bed early," and there's other people who are like, "I go to bed really late." What are your thoughts on that?
Yeah, I don't think so. I run that into that with a lot of people in my courses because they believe that they are night owls, but I truly believe it's a conditioned belief. It's something they've learned somewhere along the way. Nobody is truly a night owl. These are the natural rhythms of the day. And what I found with my clients is when they start to experiment with this and going to bed earlier, they find that they are much more productive. They are more creative in general. And that's the thing. Usually night owls say, well, I'm so much more productive at night, or I'm much more creative. But when they start to make that shift, they see, oh, I can be productive and creative at other times of the day if I'm aligning with this rhythm.
Okay. So that's good to know because I hear that from, you hear that from a lot of people. They're like, I can't go to bed at 9:30. Or
Yeah.
I always get comments because I go to bed at like 9:30, 10, and I'm pushing it a little bit now because my boyfriend is a night owl. So
Mm,
I'm like, I'll go to bed at 10:15. But usually like it's not out of the norm for me to be like sound asleep at 9 p.m. because that just feels
yeah.
right. And I wake up like at 6 o'clock and I'm like, we're ready to go.
Right. Yeah. Yeah. And that's another thing that is really interesting. I think once we start to align with these patterns, with this rhythm,
Mm.
we start to see how they benefit us. And when we go out of them, we become very sensitive. So now if I don't go to bed by like 9:30, 10 o'clock at the latest,
Yeah.
I notice it the next day.
Yeah.
I'm not functioning as well.
Yeah, definitely. I can totally feel it as well. And I thought it was just me feeling it, but he actually saw it too. He said, we're gonna have to go to bed earlier. He's like, you can't like deal with going to bed late. I was like, I can't. Like it
Yeah.
just doesn't work for me. So,
Yeah.
but we'll make that work out because he needs to go to bed earlier than 1 a.m. So,
Yeah. Yeah.
and let's see, what else? So, Ayurvedic is derived from India, and it's been
Yeah.
around for like 1,000 years. It's been around for really, really
Oh, long time, longer than that. So documented 5,000 years, but most people think it's been around much longer than that. It's considered the world's oldest holistic healing system.
long. Oh, wow.
Yeah, and it's also the sister science to yoga. So, if you were practicing Ayurveda, yoga was part of your daily routine. And if you were practicing yoga, you were living an Ayurvedic lifestyle.
Okay.
However, when the British came to India in the 1800s, they brought Western medicine with them and believed that it was better than Ayurveda, and so they banned the practice of Ayurveda.
Oh,
So it was kept alive, fortunately, in some more rural areas of India. And so when yoga came to the West, it didn't come with Ayurveda, even though they used to
oh,
be linked. And
Okay.
it wasn't until much later that Ayurveda started coming to the West. And it's actually seeing quite a resurgence right now for a couple of reasons. One, I think Western medicine is seeing, there's been a lot of research with Ayurveda, and they're seeing that it's really helpful in healing some of these disorders, these modern diseases and disorders that have Western medicine sort of scratching their heads,
Yeah.
like IBS
Yeah.
and autoimmune issues.
Yeah.
The other reason is I've been talking about this dinacharya and this clock, aligning with our natural rhythms. So this idea is at least 5,000 years old in Ayurveda, if not older. However, in 2017, the Nobel Prize in Medicine went to these three scientists who were doing work in what they're calling circadian medicine, which is basically this idea that there is a rhythm to the day, and that if we go to bed at a certain time, wake up at a certain time, eat at certain times, our body functions more optimally. And this is exactly what Ayurveda tells us with its dosha clock.
That's interesting. I'm going to look at that study because
Yeah,
that's going to be okay. I'm going to definitely look at that. So that was
yeah.
when was that? 2017?
2017. The
Okay.
Nobel Prize in Medicine. And there's actually a great book on that written by an Ayurvedic doctor. It's called Change Your Schedule, Change Your Life. And so he brings in these studies that show that this is the circadian medicine, or this dosha clock, is incredibly important to our health and wellness.
Okay. Perfect. And when you left litigation, did you see yourself getting better just a little bit more?
Oh yeah. I mean,
Because that stress, alleviating.
that stress, yeah, was a big part of the issue. And I also think it was, so in Ayurveda there's this idea that when we get sick, it's our body's way of telling us that we are not in alignment with our dharma.
Mm,
And so the longer I stayed in litigation, I was still not doing my dharma. So I still never fully healed until I left, it was actually, so my last IBS episode was in February of 2017, and I officially left litigation in May of 2017. So there was certainly a correlation there.
okay.
Uh,
'Cause there's this quote. Gosh, what is it? It's something like, "You can't get well in the same environment that made you sick."
oh, absolutely.
Yeah, and that
Yeah.
rings true, I think, for a lot of people, for me, for a ton of people, because you can't really, because I'm a healthy person, but when you're in certain environments that made you sick, like contributed to your poor health, how are you going to get yourself totally 100% if you stay there?
Yeah, yeah, yeah. That's one of the things I ask my potential clients is, are you in an environment where you can heal?
Mm,
Because that's a big part of it.
yeah, definitely. Let's see. How about diet? What is your thoughts about diet and meat? Because, depending on who you talk to, some people are like, no meat. Some people are like, no, you have to be vegan to actually be healthy.
Yeah.
What are your thoughts on that with Ayurvedic
Well, a couple of things. First, I'll just say, Ayurveda is really about guiding us back into understanding our body.
Okay.
And so when we understand what our unique constitution is, when we understand what the doshas are, when we understand how to bring ourselves back into balance,
Mhm.
we're tuned into our bodies. We're not looking for information outside of us. And that's really, like, to me, the magical part of Ayurveda. We already know what we need to heal. Our bodies want to heal. They
Yeah.
want to thrive.
Yeah.
And if we're tuned into our bodies, we already know how to do that.
Yeah.
And so while there are some guidelines in terms of what to eat from an Ayurvedic perspective, I'm more interested in guiding people into understanding their bodies first and making decisions for themselves.
Okay. All right.
Um, so from an Ayurvedic perspective, and I'll talk about meat a little bit. So meat generally isn't recommended, but if you do have a lot of vata in your constitution, it can be recommended because it's got a heaviness to it and a groundedness to it that can help balance vata. So it's seen more as medicine, as opposed to, you know, a chunk of meat, right?
Okay. And
Yeah.
can you explain the three doshas, like just the quick things that you would be like, oh, that person's more vata, or I'm pretty sure it's a big
Yeah.
list,
Yeah.
but what are the main things that stick out?
Yeah. So, like I mentioned, we all have all three doshas, but we typically have one or two doshas that are dominant.
Okay.
So I'll just go through the doshas. There is Vata dosha, and Vata is made of the elements of air and space or ether.
Okay.
So it's often thought of as the windy dosha because it's got air, but it's got space to move through. So it's moving things around. It's one of the qualities of it is mobility.
Okay.
It's cool, it's dry, it's light.
Okay.
So people who have a lot of Vata in them are, they're usually light in their frame. They're thin. They may tend towards having dry skin. They may feel cold a lot of the time. And they're also very creative people.
Okay.
When you have Vata as your dominant dosha and that Vata goes out of balance, you're going to feel more scattered. You're going to feel anxious and fearful. And your skin is going to be really dry and you're going to be cold all the time. And you might even be underweight.
Mm,
Yeah.
I experienced
So,
that. Am I vata? I don't know.
yeah. So, yeah, you may, well, we'll talk about that.
Yeah.
And then there's Pitta. So Pitta is made of the elements of fire and a little bit of water, but mostly fire.
Okay.
So Pitta people, they usually have more of like a medium frame. They're usually very athletic people. And then personality wise, you know, they're fire. So they can be very passionate, very driven.
Okay.
When that goes out of balance, it can turn into irritability, anger, being really bossy and pushy. They can also tend to be very perfectionistic.
Mm,
Um, and also when it's out of balance in terms of physicality, it may lead to like acid reflux or, you know, burning sensations in the body. Skin issues are usually a pitta issue.
okay. That's good.
Yeah, yeah. And then kapha is made of earth and water. So someone who is kapha dominant probably has a bigger frame, bigger bone. They're usually very strong and durable. You know, they just have more endurance to them. And personality wise, they're very loving, compassionate, and um, and just really loyal people, really grounded. When they're out of balance, though, that can turn into they might be apathetic. They might find themselves sitting around too much and, you know, not as motivated. Um, and they can get a little greedy and can feel sorry for themselves a lot.
Okay.
Yeah, yeah. And then in terms of out of balance, being out of balance with kapha physically, that might show up as being overweight, feeling swollen or having more fluid in the body because it's got that water aspect. Um, and it's also very related to the lungs. So actually any kind of congestion is usually a kapha imbalance.
Interesting.
Yeah.
Okay. A lot of light bulbs went off in my head.
Yeah.
That's interesting. I like that. And so if somebody comes in with those issues, you would just be looking at their whole life in general.
Yeah, well, I want to look at everything so I can see what's taking them out of balance, what's making that kapha go out of balance, what activities, what foods, and even just ways of thinking can take us out of balance. Like perfectionism is a great one. You know, if we think we have to be perfect all the time and we're not doing enough, we're going to throw pitta out of balance.
Okay. All right. That makes sense.
Yeah.
And then when you eval someone, so when you're looking at their questionnaire and then when you speak with them, that's how you figure out what their unique makeup is.
Yeah, you know, sometimes I don't even do that in an initial evaluation because sometimes people get too caught up on that. And I really just want to help them bring themselves back into balance.
Okay.
And start to understand what some of the things that they're doing that are taking them out of balance. So yeah, I don't necessarily start with that.
Okay. All right. And let's see. So this is I've never seen an Ayurvedic practitioner, counselor, anything. So all of this is super new to me. Let's see. Is there anything like that I should ask that I don't know to ask that
Mm,
you think that everyone should know? Because like I said, I looked at this, but the books for this are pretty, it's a dense subject. And it's
it
not
is.
something you can just read a quick paragraph or two and be up to speed with.
Yeah, I would say talk to as many people as you can. So if you're thinking about going to see a counselor or practitioner,
Mhm.
talk to a few of them. Most of them will offer some sort of 15-minute consultation. It's
Mhm.
important that you have a good vibe with that practitioner or counselor, because we're not going to be able to explain all of Ayurveda to you. So there
Yeah,
is going to have to be a certain amount of trust
yeah, yeah.
in that person. And so just make sure you find someone that you feel comfortable with and that you feel like you can trust.
And that makes sense because for a Western medicine doctor, I'm not going to go to an orthopedic surgeon and expect him to tell me about all his knowledge that he knows. I'm going
Right.
to expect him to know how to treat me and treat
Yeah.
me well. So yeah, that makes sense. Any kind of practitioner, you just want to make sure you're comfortable with them and you trust them.
Right, right. The other thing I would say is to be patient. We're so used to in Western medicine getting a prescription, or in worst case scenario having a surgery and then being done with it.
Yeah.
But that's not really the approach that Ayurveda takes. So Western medicine is usually it often treats the symptom rather than the cause,
Oh
and
yeah.
Ayurveda is more about treating the root cause. And if you've had that root cause, that same thing taking you out of balance for a long time, it can take a while to bring you back into balance.
Yeah, definitely.
And to just be patient. And I guess that's why the trust factor is really important, because you do have to be patient. You have to trust that they know what they're doing, and they're taking you along a path of healing.
Okay. Yeah, that makes sense. I understand that. Now that you said that, I was like, that makes sense. Let's see. Is there anything about Ayurvedic or your profession that people misunderstand that you would want to get cleared up? So
Hmm.
Ayurvedic is coming around, you're right. Like a lot of people are looking at it, but it's still not well understood.
Yeah. Yeah. Well, I guess what I would say is, I think the thing that turns a lot of people off is they hear all these things. It seems really uh, unusual to them, and there's a lot of rules,
Yeah.
and that can be really off-putting. And I will just say that yes, there are a lot of what I call guidelines, but as I was mentioning before, they're really about it. To me, the guidelines are a path back to you learning how to heal yourself
Mm.
and learning how to bring yourself back into balance, and to not feel like you have to follow all of the guidelines all at once, and just start somewhere,
Yeah.
and you'll start to see some changes, and then you can add something else. And to not be afraid of the guidelines or rules, and not feel rigid about them, because when we are rigid about rules, that takes vata out of balance. So we don't want to be that either.
Oh, okay. That makes
Yeah,
sense too.
yeah.
Let's see. So I'm going to ask you just some like random questions here, just so get to
Okay.
know you, okay? Some of them were kind of weird. Let's see. Oh, what makes you feel inspired to be your best self?
Mm. I guess it's my work that inspires me to be my best self. Seeing that I can help people make changes in their lives,
Mm.
and because changing is hard, right? Yeah, like making changes is really hard, and if you can help someone do that and help them feel better, that's just amazing. And I can't do that if I'm not taking care of myself.
Yeah. Yeah.
Right? I can't be fully present for them. But if I am fully present for them and I can help somebody change their life, that ripples out
Yeah.
into the world in
Yeah.
so many ways. So that's what inspires me to be my best self and take care of myself.
It's your good intention to give out to other people.
Yeah, yeah.
Okay, I like that. All right, let's see. What does wellness mean to you?
Yeah, so I will go back to the Ayurveda definition of health. The word is svasta, and it basically means abiding in one's own true self.
Ooh,
Yeah, so, in
that's deep.
Yeah. So in Western medicine, we typically think of wellness as, no disease. But
Yeah.
in Ayurveda, it's much more than that. It's not only being free of disease, but being in balance and being aligned with your values and working towards your dharma, your duty, your life path,
Mm,
and also really just having access to all of yourself. So when we are out of balance, we don't have as much access to our emotional agility or our mental clarity or our intuition or our bliss.
yeah.
And so when we are in balance, we have more access to ourselves. And when we have more access to ourselves, we can realize more of our own potential.
Yeah.
So
Yeah.
that's wellness.
Yeah, definitely. I love that definition. I really do. I was like, how can I make that my definition? I have to look
Yeah,
for it.
yeah, that's one of the things that's so attractive, or was so attractive for me about Ayurveda, is just the way that they explain things is just big and artful, like just beautiful.
Yeah, that one, that wellness answer really resonated with me. I love
Yeah.
it. And let's see, one more. What's the best compliment you ever received?
Oh, I would say when somebody tells me that I have a very grounding and calm presence, I
Mhm.
feel like that is the biggest compliment because I do have a lot of vata, and vata is not very grounded and not very calm. So I work at making sure that I'm keeping that vata in balance. So when I'm reflecting
Mhm.
balance, or when I'm reflecting groundedness and being calm, like it feels great because I feel like the work is paying off.
Okay. Yeah, that is a
Yeah.
nice compliment because Vada's airy and they have space, right?
Yeah. Yeah.
Yeah, so you would be more like, what's the one that's grounded?
Kapha.
Kapha. Okay.
Yeah. And so if I, even though I have a lot of vata in me, so whatever your dominant dosha is, that's the one that tends to go out of balance the quickest.
Oh,
And so that's why I have to keep an eye on it, because that's the one I'll get ungrounded really quickly if something happens. And so recognizing when that happens for me and knowing that there are practices that I can do, or even foods that I can eat that help bring me back to my balanced state where I am grounded, that's the work.
okay. All right. I like that.
Yeah.
This this has been wonderful. Is there, I feel when you are into a new subject matter that you don't really know about, sometimes I'm like, I wonder if I've asked everything I needed to ask subject because they don't know. So is there anything left that maybe that we can say about anything?
I guess I'll just say this. One of the things that Ayurveda has taught me is that we are already whole. We have everything that we need to be healthy.
Mhm.
And it's really just a matter of learning what the tools are and how we work.
Okay.
We're none of us are broken. We don't need to be fixed. We might be out of balance,
Yeah.
and we can bring ourselves back into balance. I guess that's really important to me, is knowing that we're not broken. We're not inherently broken. We're whole as we are.
I like that. I love that too. Maybe I just need to see an Ayurvedic person
Do
because I like the
we need to set up an appointment?
I know. I love the philosophy. That really resonates with me too. That's what I want.
Yeah.
Okay. All right. Well, I loved having you on.
Oh,
So
thank you
I
so
will,
much for having me. It's been
yes,
fun.
yes. Thank you so much.